Having a hip or knee replacement can be painful, but there are things that can be done to help manage this pain and to support you during your recovery, which will now be explained to you.
Pain is very individualised. You will all manage your pain in very different ways, and you will also manage your pain medications in different ways. What's really important to us is that you are able to achieve comfort after your surgery in relation to the surgery that you are having. Some of you will have many chronic pain conditions for which you are already on medications. We will try not to interfere with those medications as much as possible. However, occasionally we may need to alter doses in order to manage your post-operative pain. It is really important to us after surgery that you are able to relax and to achieve some sleep. Initially after your surgery, your sleep will be disturbed due to the very nature of the surgery that you've had, but hopefully by giving you appropriate pain medication, we will enable you to get a good night's sleep. Early mobility and compliance with the physiotherapy exercises is really important in the immediate post-operative phase. We want you to be up and mobile as early as possible, and we do not want pain to be limiting your exercises. Well-managed pain is really important by reducing stress on your body. We want your tissues, joints and muscles to heal as early as possible and not to be prohibited by you being in pain. Ultimately, earlier discharge from hospital where you can continue your care at home, continue your progress at home is what we're aiming for. When we talk about assessing pain in hospital, we use a numerical scoring tool from 0 to 3. Some of you may have been in previous hospitals where you've used a scoring tool of 0 to 10, but that really doesn't matter as long as we have some idea of the intensity of the pain that you're experiencing. If you find it difficult to attribute a number to your pain score, that's absolutely fine. We will ask you to describe it to us in terms of none, mild, moderate or severe. We are aiming for a pain score of 1. It is unrealistic to expect no pain, and we cannot promise no pain. But inevitably what's really important is that you are able to function with the level of pain that you are experiencing. By this we mean that you are able to get yourselves in and out of bed, move around the ward, and to be able to take part in your daily activities without pain compromising this. These assessments will be regular, and if we give you additional pain medication because your pain scores are higher, we will reassess this and act upon the result. Please let us know as early as possible if you are experiencing any side effects from the pain medications that we are giving you. We are considerate of any chronic pain medications that you may be taking prior to admission. Ideally, we hope not to interfere with these medications, but occasionally it may be necessary to slightly adjust the doses that you may be taking. Prescribing pain medications after surgery follows a multimodal approach, and an acute pain nurse will review to make sure that this is the correct medications for you. We use a combination of pain medications according to an analgesic ladder. This will include anything from basic paracetamol, non-steroidal anti-inflammatories if appropriate for some patients. We use opioid-based medications, we use local anaesthetics, and sometimes we can use nerve calming drugs to help relieve your pain. We always aim for pain medication tablets and liquids. You will find yourself on a combination of tablets. We do use ice in order to help reduce swelling, which inevitably can cause you pain. These pain medications will be delivered to you on a regular basis, but please report any uncontrolled pain before your usual dose is due. Breakthrough pain may occur if you have had a strenuous exercise session or you're unable to get to sleep due to pain. If this is the case, you will have some additional pain relief available to you that you can ask for or that you were able to take yourself at home in order to help you through these periods. If your pain medication is unsuitable, please let us know as early as possible so that we can get the right medications for you before you are discharged from hospital. Your discharge medication will incorporate 7 days worth of pain medications. This should be enough to get you through your initial post-operative pain, and the idea is that you gradually reduce them at home to prevent dependence upon these medications. If more medications are needed, we initially will suggest that you continue with any pre-admission pain medications that you are having. If this is not sufficient, we may advise you to call your GP for further prescription of some of these medications. Some of the strong pain medications can cause you to have side effects. They may cause you to feel a bit drowsy, to have a dry mouth, to feel nauseous, sickness, feel a little bit lightheaded. They may cause you to itch. They may cause you to become constipated, have some breathing difficulties and difficulty passing urine. Each of these side effects can be remedied by adjusting the doses to make the drug more tolerable for you.